the highest fluoride uptake in the shortest time? That's APF, Acidulated Phosphate Fluoride. But one wrong move on a patient with composite fillings and porcelain crown, and you will etch their smile permanently. So, hi everyone, this is Dr. Smiley, and today is the part 3 of the fluoride series, which is acidulated phosphate fluoride. We are going to cover the technique of preparation of APF, the Brudevold technique, the mechanism of action of APF, and surely the red flags, the safety red flags you must know before you pick up the gel tray. So let's get into it. You know how they are going to test you, you will be prepared and you will know exactly which part of this lecture you can't afford to miss. So let's turn your study time into high scores. So the most commonly asked previous year questions are given below. 2 of them are LAQs and 2 of them are SAQs. So let's see what they ask us commonly in the previous years. So the first question is classify different modes of fluoride administration. So modes of fluoride administration, this we have studied in the first video of our fluoride series, and we are going to see this further in this video as well. And the other part of the question says write in detail about the Brudevold technique. Brudevold technique is very important. If someone asks you Brudevold technique or technique of APF application, both means the same. The second LAQ is APF gels and solutions. The third question, which is an SAQ, it is APF gels and its technique of application. Again, by technique of application, what do you mean? You mean it's Brudevold technique, right? APF का technique पूछा मतलब it's Brudevold technique. Question number 4 is APF solutions and its technique of application. Again, technique of application means Brudevold technique. So either ways, what they are going to ask you is either about these APF solutions, or it's about the APF gels, or it's about APF, commonly APF. If they ask you about APF only, you have to speak about the gels as well as the solution. And whatever they'll ask you about, they'll surely ask you about technique of application of APF, which is the Brudevold technique. Are we clear? So in this topic, only these questions will be asked. Either they'll ask you APF, or they'll ask you APF gel, or they'll ask you APF solution. Whether they ask about gels or they ask about solutions, you should know what is the mechanism of action of these gels and solutions and how these gels and solutions are prepared. Okay, and also how do we apply these gels and solutions. So there are majorly 3 parts to it: the preparation, the mechanism of action, and the technique of application. So with that, we come to the next part of our video, which is the content. What is the content of this video? We are going to see the introduction, that what is APF, what is its pH, why it's important, what is its effectiveness, what is the technique of application and everything. The second is the method of preparation of APF solutions and gel. How do you prepare the solution and gel? Anywhere and everywhere the question is asked, tell us about APF gel or tell us about the APF solution, we have to say that how it is prepared. That will be the first part of our answers. The third is the most important part of this whole video, okay, which is the Brudevold technique. This technique will be surely asked in your examination if fluoride comes. Okay, then there is mechanism of action of APF. So the gels and solutions have the same mechanism of action, right? Only their consistencies are different. Then we have advantages of APF and disadvantages of APF. So in this video, we are going to see all of these. Okay, so this is the first part of the first LAQ. They asked you what are the modes of administration of fluoride. So you have to make this whole chart, and I have kept this so that I can tell you where does acidulated phosphate fluoride lies. So acidulated phosphate fluoride is a professionally applied fluoride, which is a topical fluoride. Okay, so basically fluorides are either systemic fluorides or topical fluorides. In topical fluoride, again we have the professionally applied and the self-applied. So acidulated phosphate fluoride is the professionally applied topical fluoride. Here the fluoride concentration is very high, okay, and we get the results in shorter period of time. In less time we'll get the desired result. Moving forward, we come to the introduction. Now, Brudevold et al. He did a systemic investigation. Why did he do the systemic investigation? To find out what is the optimal fluoride acid solution. Okay, now this fluoride solution APF is an acidic solution, and we all know what does acid do to our tooth? Acid dissolves the enamel, right? So, what did Brudevold do? Brudevold did a systemic investigations to find out the optimal fluoride acid solution. What is the optimal concentration of the fluoride acid solution, which will give us the maximal fluoride deposition with minimal demineralization. Just understand, fluoride acid solution. Now we are going to apply an acidic fluoride solution on the teeth. So we have to make sure this acidic fluoride solution causes minimal demineralization and maximal fluoride deposition. It means that it should not harm the tooth and provide benefits for the tooth. Do you understand? So he did a systemic investigation to find out the optimal concentration of fluoride, which will give us the maximum fluoride deposition and minimum demineralization of tooth. And then he concluded that semi-annual, by semi-annual we mean 2 times a year. Okay, semi-annual application of 1.23% of APF for 4 minutes is helpful in reducing caries by 28%. So what is this statement saying us? In a year, in 1 year, there'll be 2 applications of APF for 4 minutes, right? So semi-annual application of 1.23% of APF for 4 minutes is helpful in reducing caries by 28%. Now the pH of APF is acidic and the fluoride concentration is 1.23%. Also we can write it as 12300 ppm. Okay. Now what is the practical difficulty in topical applications? The most faced difficulty is that the teeth must be kept moist for 4 minutes. And in children, the patient compliance is difficult. So the teeth has to be kept moist with the gel or the solution for 4 minutes continuously. So this becomes difficult in children. Also, APF is acidic. Since it is acidic, it has sort of sour or bitter taste. And therefore, repeated application for 4 minutes, for continuous 4 minutes becomes difficult in children. Moving forward, we'll see the method of preparation of APF solution and APF gel. We'll first see the method of preparation of APF solution. Then we'll see the method of preparation of APF gel. So let's begin with the preparation of APF solution first. So for preparation of APF solution, we need 20 gram of sodium fluoride powder. We add this 20 gram of sodium fluoride powder into 1 liter of 0.1 molar phosphoric acid. We mix both these together, and to the mixture we then add 50% of hydrofluoride acid or hydrofluoric acid. Why do we add this hydrofluoride acid? We add it to adjust the pH of the solution at 3 and the fluoride concentration of the APF solution at 1.23%. Okay, and then we get our 1.23% of APF solution. To summarize it quickly for you, the first agent we use is 20 gram of sodium fluoride powder. We add this 20 gram of sodium fluoride powder to the agent B, which is 1 liter of 0.1 molar phosphoric acid. To this mixture, we add our third agent, which is hydrofluoric or hydrofluoride acid, 50% of hydrofluoride acid. and mix it together so that we get our product, which is 1.233% of APF solution. Okay, please remember what is the pH of APF solution. It is 3. Moving forward, we come to the method of preparation of APF gel. For the preparation of APF gel, the first 3 steps remains the same. Okay, the first 3 agents also remains the same. So we take 20 gram of sodium fluoride powder. We add it to 1 liter of 0.1 molar phosphoric acid. To this mixture, we add 50% of hydrofluoride acid. Now, the amount of hydrofluoride acid added to it is controlled to adjust the pH between 4 to 5. So, the pH of the gel is between 4 and 5, whereas the pH of solutions, APF solutions, is 3. Please remember this. Okay, so coming back to the method of preparation, we added 50% of hydrofluoride acid and adjusted the pH between 4 and 5, and then to all these things we add a gelling agent, like methyl cellulose or hydroxyethyl cellulose, so that a gel formula of APF can be formed. And when we do all this process, we finally get 1.23% of APF gel. Okay, what is the MCQ question here? It is, what is the pH of APF gel and what is the pH of APF solutions? Both is acidic, but the pH varies. For solution it's 3 and for gel it's between 4 to 5. Okay, now summarizing the preparation of APF gel for you. So the first 3 agents we add will remain the same. What was the agent A? It is 20 gram of sodium fluoride powder, which is added into 1 liter of 0.1 molar phosphoric acid. Then to this we add our agent C, which is 50% of hydrofluoride acid, to adjust the pH between 4 to 5. And to all this mixture we are going to add agent D, which is a gelling agent, which is either methyl cellulose or hydroxyethyl cellulose, and then we get 1.23% of APF gel. I hope we are clear. Moving forward, we have Brudevold technique. Now, Brudevold technique is also known as technique of application of APF. Okay, so Brudevold technique is used for both APF gels and solutions application. So here the white bottle you see, it is APF gel. This red colored bottle you see, it is an APF solution. And the trays you see here are called as foam trays. They are called as foam trays. They are used along with the APF gel. Okay, foam trays are used along with APF gel. So let's begin. This technique was given by Brudevold. The technique of APF application was given by Brudevold. So it is called as Brudevold technique. So what do we do in Brudevold technique? Let's see. First, do oral prophylaxis of the patient's mouth. Then we do the isolation with cotton rolls. As you can see in this figure, we isolate the arches with cotton rolls. Then we dry all the teeth before the application of gel. Now we are seeing gel application first. Okay, please remember what we are saying. We are saying gel application first. For gel application, first what we do, oral prophylaxis, remove any calculus or plaque which is present, do all the oral prophylaxis. Then we isolate the arches with cotton rolls and then we dry the teeth before the application of gel. Now, as discussed earlier, these are the foam trays. Okay, these are the foam trays, and foam trays are used along with APF gel. Okay, now for the application of gel, you have to position the patient upright and provide a saliva ejector. Okay, take a foam tray as shown in this picture. Fill 1/3 of the trough area of the tray. This is the trough area of the tray. So you fill 1/3 to half of the trough area of the tray so that it is sufficient to cover both the arches. Okay, you fill the gel in both the arches, here also, here also. Okay, fill 1/3 of the trough of the tray. Then as seen here in this figure, we just turn the tray so that the maxillary tray faces upwards, mandibular tray faces downwards. Okay, now we place this loaded tray over the arch. Okay, we'll just insert this whole thing in the patient's mouth. Then we'll squeeze the buccal and lingual surfaces of this tray. Okay, suppose this is the buccal surface, this is the lingual surface. After inserting it, we'll squeeze the buccal and lingual surfaces of the tray to force the gel between the tray, that is to force the gel on the teeth. Now keep the tray in the mouth for 4 minutes. After 4 minutes, remove the tray from the mouth and then give the instructions to the patients. What instructions you are going to give to the patient? The first one is not to expectorate immediately, not to cough vigorously. Okay, and then the second and most important instruction is avoid eating anything, avoid drinking anything, and avoid rinsing your mouth for the next 30 minutes. Do not drink, do not eat anything for the next 30 minutes. Why do we do this? So that there is more fluoride available for the uptake. Okay, now what is the recommended frequency of topical application? How many times are you going to give this APF application? It is semi-annual. Semi-annual means twice a year. Okay, semi-annual means twice per year. Per year, nahi, twice a year. It means in a lifetime you are going to give 2 APF applications, which is in 1 year. Okay, so the recommended frequency of topical application is semi-annual, twice a year. Okay, now talking about the APF solution application. For APF solution application, everything is going to be remaining the same. The only few points which will change are that your foam trays are not used. Instead of foam tray, we used cotton applicator. So for APF solution, we used APF solution and cotton applicator. Whereas for APF gel, we were using APF gel with foam trays. Okay, APF gel and foam trays are used, whereas APF solution and cotton applicator is used. Okay, so we take a cotton applicator, we dip it in APF solution, and then we apply it on the tooth. Okay, and we let it dry, and then the APF has to be reapplied on the tooth every 30 seconds, and we have to repeat this process and keep the teeth moist for 4 minutes. After every 30 seconds, we are going to reapply the solution with cotton applicator so that the teeth remains moist with the solution for 4 minutes. So this APF solution application is comparatively difficult than the APF gel application, because in APF gel application, you insert the foam tray in the mouth, wait for 4 minutes and remove it. Whereas in APF solution application, you have to reapply it every 30 seconds and you have to make sure that the teeth is moist for 4 minutes. So it becomes comparatively difficult. So a quick summary. For APF gel application, you do prophylaxis and isolation first, followed by using a foam tray and filling 1/3 to half trough of the foam tray with APF gel, and then inserting it into the patient's mouth. And then after inserting it into the patient's mouth, we wait for 4 minutes and then we instruct the patient. What do we instruct the patient? Okay, do not expectorate immediately. Wait for 30 minutes until you eat, drink anything or rinse your mouth. For APF solution application, you do the same. First step remains the same. That is, you do the prophylaxis and the isolation of the teeth. Then you apply APF solution using a cotton applicator tip on the teeth. You have to reapply it every 30 seconds for 4 minutes. And then the last step remains the same, which is we instruct the patient that do not expectorate immediately. Do not drink, eat or rinse your mouth till 30 minutes. Now we have the mechanism of action of APF. How does acidylated phosphate fluoride works? What is its mechanism of action? So when APF is applied on the teeth, It initially leads to the dehydration and shrinkage of the hydroxyapatite crystals. Hydroxyapatite crystals are the crystals which makes up the enamel. So when APF is applied on the teeth, it is applied on the enamel of the teeth. It leads to the dehydration and the shrinkage of the hydroxyapatite crystals. Okay, so due to this, hydrolysis means breaking of water, hydrolysis and the formation of intermediate product, which is dicalcium phosphate dihydrate, occurs. This name is very important. Whenever you are asked about mechanism of action of APF, you should remember about this intermediate product. What is happening? You are applying APF on a tooth. If this is your tooth, you are applying APF on the tooth. Now the hydroxyapatite crystals are undergoing shrinkage. They are becoming small. Earlier their size was huge. They are undergoing dehydration and they are shrinking. Okay, due to this, an intermediate product is formed, which is called as dicalcium phosphate dihydrate. Short form, it is DCPD, dicalcium phosphate dihydrate. Okay, now this dicalcium phosphate dihydrate is highly reactive with fluoride. Okay, so this dicalcium phosphate dihydrate reacts with the fluoride in the APF solution or gel, whatever it is. It reacts with fluoride present in APF, and this leads to the formation of fluorapatite. In this way, the fluoride is deposited on the enamel as fluorapatite. Now the amount and depth of the fluoride deposited, okay, how much fluoride is deposited and till what depth the fluoride is deposited as fluoroapatite depends upon the amount and depth at which dicalcium phosphate dihydrate gets formed. Okay, this is very simple to understand. Okay, summarizing it once for you. When you apply APF on the teeth, for example, if this is your teeth, you apply APF on the teeth. Okay, so there are some hydroxyapatite crystals. This hydroxyapatite crystals undergoes shrinkage and dehydration, and therefore an intermediate product is formed, which is called as dicalcium phosphate dihydrate. This dicalcium phosphate dihydrate is highly reactive with fluoride, so it reacts with fluoride and fluorapatite is formed. Fluorapatite, from hydroxyapatite, fluorapatite is formed. So fluoride is deposited in the form of fluorapatite on the tooth. Okay, so now the amount and depth of the fluoride deposited as fluorapatite depends upon the amount and depth at which the dicalcium phosphate dihydrate is formed. The more the dicalcium phosphate dihydrate is formed, the more the fluorapatite crystals will be formed. Simple. Moving forward, since this whole conversion of dicalcium phosphate dihydrate to fluorapatite and deeper penetration is required, continuous fluoride supply has to be provided. Okay, what this statement is saying, now what do we need? We need more dicalcium phosphate dihydrate to be formed, because more dicalcium phosphate dihydrate means more deposition of fluorapatite crystals. Okay, since we want more deposition of fluorapatite and more formation of dicalcium phosphate dihydrate, we have to give continuous fluoride supply to the tooth. Okay, for this reason the teeth has to be kept moist with the APF gels or solutions for 4 minutes. This is the reason we keep gel or solution in contact with the teeth for 4 minutes. Okay, if now for 4 minutes we keep the tooth in contact with gels or solutions, so till 4 minutes dicalcium phosphate dihydrate is formed. Okay, until 4 minutes this dicalcium phosphate dihydrate gets converted into fluorapatite. Okay, moving forward, what are the advantages of APF? Okay, it has acceptable taste. Here taste is not written, so okay, it has acceptable taste even though it is sour and bitter, but still it has an acceptable taste. It does not cause staining of teeth. Being an acid, it does not stains the teeth. It has no gingival irritation, so it does not irritate your gingiva. Okay, staining and irritation to the soft tissue are one of the most common side effects of using any acids in the oral cavity. But acidulated phosphate fluoride, being an acid, does not stain the teeth, neither it causes gingival irritation. It is stable and it has a long shelf life. Okay, you can keep it in your clinic for a longer time. It does not expires in a month or two. Also, it is cheap and affordable. Talking about the disadvantages of the APF, so the first and foremost disadvantage is that the teeth has to be kept wet for 4 minutes. This is a task. For 4 minutes you have to keep the tray inside the child's mouth, or for 4 minutes you have to keep reapplying the solution. In children's, the patient compliance become difficult, so it is difficult to keep the teeth moist for 4 minutes, and the solution is acidic. For some sensitive patients, it may cause a trouble. So, coming to the most important part of our lecture, which are the safety red flags. The safety red flags are nothing but some must know tips before you use APF in your clinic. So, the first and the most important safety red flag is the aesthetic red flag. Now, what does the aesthetic red flag means? It means that you should never use APF on aesthetic restorations or prosthesis. So, what happens? Aesthetic restorations such as GIC, composite, or porcelain crowns and veneers will get ruined if you use APF on them, because APF contains hydrofluoric acid as a component, and it's an highly acidic solution or gel, so it will basically etch your aesthetic restorations and it will ruin the polish of the aesthetic restoration. Therefore, make sure you never use APF on patients who have aesthetic restorations, whether it's GIC filling or composite fillings or porcelain or ceramic crowns and veneers. But instead, what you can use, if the patient wants some protection and the patient is high caries risk patient, you can use 2% of sodium fluoride or fluoride varnishes instead of APF. But remember, you will never use APF on the patient who have aesthetic restorations or prosthesis. The second red flag is the age red flag. Okay, so it says that you should never use APF trays for children below the age of 6 years old. Why? Because young children lack the muscle control to keep the gel in the tray and they are highly likely to swallow it, leading to acute fluoride toxicity. Okay, so therefore we'll never use APF trays in children below 6 years of age. The third red flag is the empty stomach red flag. It says that make sure the child is not hungry or have an empty stomach before the application of the APF gel. Why so? Because if the child haven't eaten all the day, they are more prone to nausea even if a tiny amount of APF is swallowed. So the child is going to vomit on your chair. So make sure the child has eaten something before you start the treatment. And last but not the least, make sure the child follows the post-operative instruction. Remind the patient that they do not have to drink, eat or rinse their mouth for the 30 minutes, or else you are washing away all the hard work that you have done. Okay, so coming to the last part of our lecture, and that is the quiz. So the first question for you is, how is professional APF application recommended? How often is the professional APF application recommended? Twice a day, twice a month, annually, or twice a year? What is your answer? Yes, it's twice a year, or we also say it as semi-annually. Semi-annually or twice a year. Okay. The next question. What is the standard concentration of fluoride in APF gel or solutions? It is 1.32, 1.23, 2.32 or 2.23. Yes, you are correct. It is 1.23%. Going to the last question, you are going to comment the answers in the comment box for this question. What is the typical pH of APF gel? please remember the pH of APF gel and solution is different. Now you have to comment your answer in the comment box that what is the typical pH of APF gel. So, before ending the lecture, I would like to say that APF is great for speed. But what about the kids who gag on trays or have a mouth full of fillings or aesthetic restorations where you can't give APF solutions and gels? For this, there is a modern solution that is stickier, safer, and stays on the teeth for hours. And that is nothing but the fluoride varnish. In the next video, we are going to break down the Dura Fat and Floor Protector, the two products that completely changed the pediatric dentistry. So hit the subscribe button, drop your answers in the comment box, and be ready for the next class, which is the Varnish Masterclass.